Welcome, everyone. Thank you so much for joining our year-end webinar. Today, we are talking about the top nutrition and cancer insights in 2025 and reviewing a few very interesting papers. So this webinar is presented by the Create Cures Foundation Clinic. So I will go on to the next slide. So first, we are dietitians from the Create Cures Foundation. We are a clinic, a nonprofit clinic founded by Dr. Walter Longo, PhD, who's a leading researcher in nutrition, specifically focused on aging, cancer, and age-related diseases. At Create Cures, we're a team of expert registered dietitians, molecular biologists, and Dr. Longo himself, and we work on collaborative care for our patients with the goal of developing effective and integrative strategies to support cancer therapy and optimize outcomes for our patients. If you're interested in working with us, we'll share our links at the end to connect and also in the chat box. But please remember that today's webinar, the video content and the information provided are intended for general knowledge only. It's not a substitute for professional medical advice, diagnosis, or treatment for specific medical conditions. So please don't use this information to diagnose or treat a health problem or disease without asking your healthcare provider. I also want to mention that we have a few new projects that came out this year. To dive deeper into the science and real-world application of Dr. Longo's work, I really encourage everyone to check out his documentary that came out this year called Fasting and the Longevity Revolution. It shares powerful stories of patients, clinicians, and the research driving the use of fasting and fasting-mimicking diets in cancer care. You can visit it at the link listed, fastingandthelongevityrevolution.com. And then we also released his latest book, Fasting Cancer, which goes into the science and practical applications behind some of the interventions that we're going to touch on today. And it's a really great resource, whether you're a healthcare professional or someone supporting a loved one. Every chapter is about a different type of cancer and the research behind fasting and fasting mimicking diets. And at the Create Cures Foundation, we're proud to help bring this knowledge to the public and always invite you to keep learning, sharing, and staying connected with us. And I'd like to introduce ourselves. I am Lotta. I'm a registered dietitian at the Create Cures Foundation. I received my master's degree in nutrition, health span, and longevity from the University of Southern California. And I studied the interaction of nutrition and genes on disease and longevity under Dr. Walter Longo at the University of Geneva. My passion is culinary nutrition and working with patients to help incorporate nutrition recommendations into their lifestyles in an enjoyable way.
Amazing. Hi, everybody. My name is Shayna Feinerman. I'm also a registered dietitian here at Create Cures. And I also got my master's degree in nutrition, health span, and longevity and studied under Dr. Longo in Genoa. So I have a really strong passion about helping my patients use food and diet lifestyle to help them along cancer journeys or even just helping improve their longevity. So we're really looking forward to discussing the current research done in cancer nutrition and lifestyle today with you all.
Thanks, Shayna. And here's our agenda for today. So first, we'll be going over a study that looks at overall lifestyle and how it influences cancer risk, and then going into some details about fasting, meal timing, nutrition, exercise, ending with some practical tips, a little quiz, and some Q&A. So you can ask your questions at the end of the webinar. If you use the Q&A box to ask your questions, if you have any individual questions about specific patient cases or questions about working together, you can email us and we'll be happy to answer those questions too. So the first study that I'd like to highlight is an exciting review paper that came out this year that shows just how much our lifestyle can reduce our risk of cancer. This was a 2025 meta-analysis of 28 cohort studies that found strong adherence to cancer prevention guidelines was associated with a 14% reduction in total cancer risk. And it additionally looked at individual cancers and found some increased benefits for lowering risk for colorectal cancer, breast cancer, lung, kidney, esophageal cancer, uterine cancer, and some obesity related cancers. So there are 10 recommendations that are part of these guidelines, and we'll go into some of these in detail today. But the main message here is very empowering that our lifestyle choices matter. We have opportunities every day to influence our risk of cancer through our actions, and we'll be digging into some of those studies today. And I'll hand it over to Shayna to talk about fasting and cancer first.
Amazing. Thank you, Lotta. So let's get into fasting and cancer and what actually is it doing when someone has cancer. I'm sure many of you have heard recently that fasting is good for cancer, but let's dive into exactly what it does. So before we get started, I'm curious if any of you already know potentially some of the benefits of fasting with cancer treatment. So utilize the chat box and let's see if anybody has some ideas of what it could do. Okay, immune boosting, I'm seeing. Limiting side effects of chemo. Yeah, it seems like starving the cancer cells. Okay, so everybody's on the right idea, but let's break it down exactly how that happens. So first I'm going to review actually a study published in October 2024, so I hope you'll all forgive me. But this is one of Dr. Longo's recent studies that really is a great review and overview of how fasting helps improve outcomes and what it actually does during cancer treatment. So, one of the main key concepts is looking at the growth hormone IGF-1 insulin access. So, if you've ever had a consultation with one of us at Create Cures, you've probably heard this IGF-1 concept before. IGF-1 is insulin growth factor. And so, obviously, when we think of growth, we do not want a lot of growth during cancer. So, diet can actually strongly influence your IGF-1. And you can measure this. You can take your IGF-1 and see what it is. And elevated IGF-1 might contribute to cell proliferation, reducing cell death, and increasing DNA damage risk. On the other hand, low to normal IGF-1 supports longevity and reduces incidence of many cancers. So on the right, you'll see that IGF-1 sort of falls under a U-shaped curve, meaning that high IGF-1 again can contribute to growth and aging, cancer risk, whereas low IGF-1 could also be an indicator of low muscle mass and low immune function. So ideally, we want to see our IGF-1 be around 120 to 160. Some of the evidence we see that was listed in the study was that high circulating IGF-1 can increase risk of breast, prostate, colorectal, and other tumors. And again, excess growth hormone IGF-1 is associated with higher cancer mortality. We can move on next. So, what can contribute to IGF-1 being really high? So, animal protein can raise IGF-1. On the other hand, plant protein does not raise IGF-1 as much. So it also, plant proteins tend to increase IGF-1 binding protein. So it helps bind IGF-1 circulating, leading to lower serum IGF-1. And then in this a specific study, people ages 50 to 65 years old that were eating a high animal protein had a 4 times increased cancer risk. And this was not seen with plant protein. Some of the FMD cycles, what are they doing with IGF-1? So the periodic fasting or FMD and fasting mimicking diet, I should define, is a longer term, usually around 5 day fasting mimicking period. So there is consumption of some nutrients, but not enough to get out of the fasting state. So this longer fast lowers IGF-1 more than calorie restriction. So that would be a daily, everyday restricting calories. And actually, the fasting mimicking diet is more effective. We see in the mice FMD cycles lowers IGF-1 considerably by 45%, glucose by 40, and again, increasing IGF binding protein, which we do want because that lowers our serum IGF-1 by 11 times. And similarly in humans, we see 3 cycles of the FMD lowers IGF-1 by 24%, with it even remaining low when you return to your normal diet. And finally, what fasting creates is something called differential stress resistance and differential stress sensitization. And let's define that in the next slide. So we see that fasting does something pretty magical to our cells, and it's different in normal cells versus abnormal cells or tumor cells. So you can see in this diagram that in the normal cells, it actually causes protection against stress, increased resistance to chemo. So when you have chemo, it can protect the normal cell and it can lower DNA damage and oxidative damage to your normal cell. On the other hand, in your tumor cells, it actually, your tumor's cells get so confused. There is no protection against the stress. It lowers resistance to chemo, so it improves the efficacy, and increases DNA damage, and it increases oxidative damage, which we want in the tumor cells. And these mechanisms are the same by lowering IGF-1, by lowering glucose and insulin, and increasing IGF-1, IGF binding protein, as well as ketone bodies. So it's really incredible what it can do to your normal cells, but also your abnormal cells. What can we take away from this review? We want to be sure to maintain IGF-1 in the mid-range, so about 120 to 160 for lowest mortality. And diets high in animal protein, sugar, and dairy, these can all increase your IGF-1, insulin, and cancer risk. So we want to aim for more of a plant-rich, low to moderate protein, and low sugar diet to keep IGF-1 optimal. We know that fasting, and we'll even talk about overnight fasting, can also enhance the efficacy of treatments and lower IGF-1 and increase tumor sensitivity and reduce therapy resistance. And finally, there's actually also an obesity connection with IGF-1. So with obesity, we tend to see more insulin resistance. So meaning that your insulin is not so sensitive. It kind of gives up a little bit. This can contribute to higher insulin growth factor, resulting in higher inflammation and also promoting cancer progression. So that's why even overnight fasting and having a healthy diet can, again, reduce or improve insulin resistance, reduce obesity, and lower inflammation. So that's very, very important as well. Even in breast cancer studies, increased IGF-1 levels was associated with a twofold risk of breast cancer mortality in women with a BMI higher than 25 than in lean ones. So body composition, and we'll talk about later, even exercise, it all plays a big role in lowering inflammation too. Next study is a review paper published January 2025, and this is on dietary restriction and cancer prevention. So first, let's talk about these different meanings. Calorie restriction, again, this is like an everyday restriction of calories. Fasting mimicking diet, that's more of that longer term, but not all the time, like 5 days fasting out of the month. And then time restricted eating, which is overnight fasting. And some people also will define this for intermittent fasting, but it's important to distinguish both. So again, what are the mechanisms behind how all of these dietary restrictions can have anti-cancer effects? It lowers that IGF-1, so less growth. It lowers your insulin, improves sensitivity, so reduces a pro-tumor metabolic environment. You'll often hear us say we want to make our bodies less favorable for cancer growth, so that these are all very important for making that environment less favorable. It lowers your mTOR pathways, which are important for autophagy and mitochondrial function. And then finally, it lowers chronic inflammation, so there's less signals to grow cancer cells. What do we see in the evidence? Well, we see that there is a lot of human evidence emerging about how calorie restriction and even fasting can improve these biomarkers. Over epidemiologically too, for a long, long time, we've seen that people undergoing calorie restriction may show lower cancer rates. And this is not to say that we should all be calorie restricted, but actually, and that would be very difficult to sustain, right? We do not want to do that. We don't want to get any deficiencies. And it actually seems that fasting mimicking diet or even time restricted eating are more feasible and actually safer, better long-term strategies than calorie restriction and just as effective. Now let's talk about this time restricted eating. So, a lot of people again will think of intermittent fasting as okay, I'm gonna start eating at like 12 p.m. and I've fasted for the morning and that's great. But actually we want to focus more on time restricted eating. So what is time restricted eating? It is the time you're restricted eating. So starting from the last bite of dinner to the first bite in the morning. And actually, the maximum benefits we see in many, many studies to support lie at around 12 to 14 hours. So, for example, if you stop eating dinner at 7 p.m., you would start eating at 7 a.m. in the morning. And this is associated with really great benefits in improving BMI, waist circumference, a lot of metabolic benefits. And actually, when you fast over 16 hours, that is associated with an increase of gallstones, diabetes, and cardiovascular disease. This is probably because breakfast is actually the most important meal of the day. So it's very important to have something in the morning. And how great is it that we can still get really great benefits just by fasting overnight? So this is super acceptable. No major safety concerns have ever been reported. What it does clinically too, it lowers recurrence risk in breast cancer. It's been shown to lower tumor markers and even help improve major molecular responses. And again, metabolic benefits too, like lowering BMI, your waist circumference, the fat around our organs, and improving glucose and insulin and all that as well. It also has been shown to improve quality of life short term. So this has been fasting. So we talked about the fasting mimicking diet a bit, that longer fast, how that is just as effective, it seems, as calorie restriction to improve cancer outcomes and get the benefits of lowering IGF-1. We talked about time restricted eating and how we want to do just 12 to 14 hours. So as an overview, really important things you could try to do now is fast for 12 to 14 hours. You can talk to us or your doctor and see if the FMD would be beneficial for you if you have cancer going through treatment. And we want to prioritize plant proteins and minimize animal protein to keep IGF-1 less than 160. And now I'm going to bring it to Lotta to talk about what our nutrition should be if we have cancer, if we want to reduce our risk of cancer.
Thank you so much, Shayna. It's so interesting to learn about the differential stress resistance and how cancer cells are unable to prevent those oncogenes, the pro-growth pathways, from being turned on. So going into nutrition and cancer, there were so many interesting studies that came out this year that it was really hard to narrow down what to include, just showing that it's a very exciting time for nutrition and cancer research. So I'm excited to get into some of the papers that we're going to cover today. First, I'd like to ask a question. You can comment in the chat box. What dietary pattern has the most evidence for reducing cancer risk? And when we're thinking about dietary patterns, there's a lot of different ways of thinking about it. There's like keto or low fat, low carb, plant, SAD diet for reducing cancer risk. Interesting. Whole foods, plant-based. SAD is called the Standard American Diet, if anybody is familiar with that. Making cancer, yeah, so that is associated with worse cancer risk, the Western diet. Mediterranean. All right, great. Lots of good comments in there. So we saw 3 meta-analyses that came out this year that looked at dietary pattern and cancer risk. And before we get into each of these studies, I do want to just quickly define what a dietary pattern is. So a dietary pattern reflects the overall combination of foods and beverages that somebody consumes, not just looking at single foods or single nutrients in isolation. So looking at the variety, quantity, and proportion of food eaten over time. And this becomes really valuable because sometimes it's hard to identify a specific nutrient that can influence cancer outcomes in the same way that like a specific drug can. But there are synergistic effects of nutrients when we're eating these whole food forms. And that's often what is associated with health outcomes. So that's why we see more evidence for dietary patterns than just specific individual foods. So the first study in the chart was an enormous study of 100 million participants and assessed how closely individuals are following the World Cancer Research Fund and American Institute for Cancer Research dietary recommendations. So that chart that I showed earlier with the 10 different recommendations, this was looking at the dietary portion of that. And what they found was for every 1 point increase in adherence, cancer risk dropped by 7%. So there was a kind of dose dependent benefit where the stronger adherence to the guidelines, the larger reduction in cancer risk. And the second meta-analysis included over 1.1 million participants and looked at adherence to the Eat Lancet dietary pattern. If you haven't heard of this before, this is also called the planetary health diet. It's a diet that's designed to support both human health and planetary health, so taking environmental impact and sustainability into consideration. And in this case, the strong adherence or highest adherence compared to lowest was associated with a 22% lower risk of cancer and a 7% lower risk of cancer mortality. And finally, the third review looked at a different type of dietary measure, which is the Dietary Phytochemical Index, or DPI. Phytochemicals are sometimes called phytonutrients. They're the same thing. They're the bioactive plant compounds that give fruits and vegetables their colors. And they're responsible for many of the anti-cancer effects like antioxidant activity, anti-inflammatory effects, and supporting immune function. And so there is some scientific basis behind the recommendation to eat the rainbow, getting that variety of plant colors. Make sure that you're getting a wide variety of phytonutrients. And so this was scoring the proportion of the person's daily calories coming from phytochemical rich foods. And it looked at 9 case control studies with a sample size ranging of around 100 to 900 participants. And it looked at the highest versus lowest intake. When you have the higher DPI score, it is associated with a 60% lower risk of all cancers, with extra risk reduction for breast cancer, 62%, and then 57% lower risk across the other cancers when pulled together. So glioma, prostate, and colorectal cancers. And that would be the highest intake of these plant foods and compared to the lowest intake. So together, looking at these 3 meta-analyses, which all came out this year, it tells a very exciting, consistent story that dietary patterns can play a big role in reducing cancer risk. And what do they have in common? They all emphasize a diet rich in whole plant foods. So we're talking about whole grains, vegetables, fruits, legumes like lentils and beans and soybeans, nuts, seeds, and then limiting red meat, processed meat, sugar-sweetened beverages, highly processed foods, and alcohol. There's some specifics between 2 of the other diets. So the Dietary Phytochemical Index was looking at specific plant foods, including soy products, olives, and olive oil. And then the Eat Lancet diet does recommend moderating fish, poultry, and dairy intake, in part because of the environmental impact of these foods. But overall, looking at these guidelines and outcomes, it's clear that a plant-rich diet is beneficial for reducing cancer risk and mortality. And the next study shows some of the mechanisms behind why these plant-rich diets are so beneficial. So this review, the role of diet and nutrition in cancer development and management, looks at how diet directly modulates cancer biology. And you can see some similar pathways to what Shayna mentioned when we're talking about the fasting and time-restricted eating. So this chart looks at the 5 key biological mechanisms involved in cancer development and how nutrition can either worsen or improve these processes. The first one to look at is inflammation, which chronic inflammation can help tumors grow and spread, and certain foods can act as either fuel or brakes for inflammation. So when we're thinking about things like omega-3 fats that have this anti-inflammatory effect and calm inflammation, compared to something like saturated fat, which can increase inflammatory response. Same thing with refined carbohydrates or those high sugar, high starch foods that can also be pro-inflammatory in excess. And then when we're looking at oxidative stress, if we have an imbalance between things that are pro-oxidizing compared to antioxidants like vitamin C and phytonutrients, that can damage DNA and increase cancer risk. So this is where, when we're talking about meat and especially charred meat, it creates these pro-oxidizing compounds. And plant foods have things like antioxidants like vitamin C and E and some polyphenols that can be reducing that oxidative stress. And then the next one, as Shayna mentioned, insulin and IGF-1 pathways. These are things that really promote cell growth, and in the case of cancer, cancer cell growth. So the high glycemic diets that increase insulin or excessive protein intake, and especially specific amino acids from animal proteins can increase these factors, whereas calorie restriction and reducing some of those compounds can reduce these growth signals. Cell cycle regulation is influenced by specific nutrients that can support DNA synthesis. So things like some B vitamins like folate or B12 and phytochemicals like curcumin and resveratrol can be very helpful for DNA synthesis and repair and regulate cell cycle division. And finally, apoptosis, which is that programmed cell death. Cancer cells often survive by avoiding apoptosis, but nutrition can help influence whether damaged cells die as they should. So omega-3s and flavonoids can help induce apoptosis, and saturated fats can actually inhibit apoptosis, so allowing those cancer cells or cells to continue to live. So overall, this chart has a key message that the dietary patterns can modify multiple cancer-related pathways. The summary is that the high carbohydrate, high saturated fat, and high animal-based protein diet can support tumor growth, where the antioxidant-rich polyphenol, B vitamins, omega-3 fats, and fiber can lower oxidative stress and lower inflammation. And this really reinforces the advantage of the plant-based eating patterns that we were speaking to earlier. Another conclusion that was in the review is about personalization, and they discuss how personalization can be the future of optimizing cancer risk and treatment. So when we're thinking about that metabolic environment inside of our body, the optimal nutritional approach does depend on so many different factors like the cancer type and stage that we have, our family history, so our genetic risk, our age, our sex, our body composition, our muscle mass compared to fat mass, what our current lifestyle habits are, and even our gut microbiome, all influence how we respond to different interventions. So we actually use the term nutritechnology to discuss precision nutrition, or how we can really target all of our interventions for each patient. In our clinic, we take a comprehensive look at each patient's individual profile so we can really target all of our interventions in a way that generally supports treatment and long-term health. All right, and the last paper that I want to highlight for nutrition is a review of preclinical and clinical trials in around the microbiome. So this is the role of the intestinal microbiome in inflammation and cancer. And this one is fascinating because it shows how those gut microbes in our gut can influence cancer risk and even influence our treatment response. So first, the review confirmed that diet and lifestyle can really influence microbiome health, where the plant-forward diets tend to increase the beneficial species, specifically Prevotella and Akkermansia, and high fat, especially saturated fat, high protein diets can promote more pro-inflammatory species, including Fusobacterium. And this matters because dysbiosis, which is an imbalance of the microbiome or the gut bacteria, can fuel inflammation. And when the gut barrier becomes compromised, there's more immune activation because our gut has a major amount of immune cells in there and can lead to chronic inflammation. It also found that the microbiome plays a direct role in cancer development. So there are some bacteria that have been shown directly in animal studies to promote carcinogenesis and influence cancer growth. And then in humans, we have some genomic analyses of colon cancer tissue. And it's identified specific mutation signatures from specific bacteria that are more common in colorectal cancers. So it looked at there's PKS plus E. coli and Fusobacterium are some genetic signatures that are more common in colon cancers, especially early onset colon cancers that develop before the age of 50. And the last very exciting aspect of this paper was talking about how the microbiome can influence how patients respond to cancer therapy. So there's response to immunotherapies in malignant melanoma that have been shown to partially depend on the composition of the gut microbiota. There's been some trials that show when you do fecal microbiota transplants or FMT, which is like stool transfers from immunotherapy responders, it can transfer those therapeutic benefits to patients who were initially non-responders to the immunotherapy. So it shows how transferring that microbiota can actually improve treatment outcomes. And then there was another study that showed how using broad spectrum antibiotics, so that can kill off a large amount of a broad variety of bacteria before starting immunotherapy, has been linked to worse survival and more adverse effects in both solid tumors and blood cancers. And this is related to that disruption to the gut microbiota and potentially leading to dysbiosis. So from this information, we're seeing some clinical applications where we can use interventions like high fiber diet strategies, that FMT or fecal microbiota transplant, and targeted microbiome therapeutics looking at specific strains to help support treatment response, reduce inflammation, and reduce cancer risk, particularly with some of these digestive tract cancers like colon cancer. So this is a very exciting, so there's so much research about the gut microbiome in general, but then even in cancer, it's a very exciting field. So, all right, I know that was a lot to cover. There's just so much to talk about with nutrition and cancer, but I just want to go over some of the main takeaways from here. So first is just that we see that the evidence continues to grow, showing how dietary interventions can both reduce cancer risk and support better treatment outcomes. And across studies, when we're looking at meta-analyses with massive amounts of people that include randomized controlled trials and observational studies and cohort studies, they all consistently point towards the benefits of plant-rich eating patterns. And it's not just the broad categories like eat more vegetables or get enough protein, but what really matters are the specific bioactive compounds, amino acids, the different types of fat. Some are more anti-inflammatory than others, phytonutrients, vitamins, minerals, and fiber. All of these things can influence gene expression, metabolism, inflammation, and more to create that optimal environment. And if you'd like to explore this deeper, we actually did recently a webinar on anti-cancer foods that you can find on our YouTube channel, and it talks about some specific foods that can include some of these nutrients and provide those benefits. We also talked about precision nutrition and nutritechnology and how the most effective dietary pattern can vary from person to person, although there are these general guidelines that we can all follow, but recommendations can be personalized based on individual risk factors, biology, and health status. And then we also finished up by talking about how supporting your gut health can influence your risk and treatment responses for cancer. So with that said, I'll pass it back to Shayna, who's going to talk about exercise and cancer.
Thank you so much, Lotta. We've talked about fasting, we've talked about everyday nutrition and what patterns seem to best prevent and also help manage if you do have cancer. And now let's talk about exercise because obviously that plays a really big role in reducing risk and even if you have cancer, improving your outcome. So I always like to tell my patients whatever type of exercise you like is what you should do because any form of exercise is going to be very beneficial. And I'd love to hear from everybody in the chat box. What is your favorite type of exercise that you do to feel good and just move your body? Okay, bar, stationary bike, and weights. I love that some of these are hike walk, stretching, biking, yoga. Amazing, running. Great. So we've got a good blend of some cardiovascular fitness as well as resistance training. And spoiler alert, both are really beneficial. So, as an introduction, physical activity plays a big role in cancer prevention and management. So, it can reduce risk of colorectal, breast, lung, bladder, and gastric cancers by 10 to 20%, which is a pretty considerable amount. In patients with breast cancer, regular exercise not only alleviates treatment-related side effects like fatigue, nausea, and muscle loss, but it also enhances overall survival, with studies showing that up to a 50% reduction in cancer-specific mortality, particularly in breast, colorectal, and prostate cancers. So, oh my gosh, if it can reduce your risk by half, like we gotta do it. So what should we do? Let's talk about the research. So I'm going to discuss a few studies here, and feel free if you guys want to zoom in, you absolutely can on your own device. But the first study we're going to talk about was a big umbrella review of over 80 meta-analyses. This looked at the impact of exercise on health outcomes in people with cancer. And so, what were the outcome? Well, like I said, it reduced treatment-related adverse side effects, including cardiac toxicity, neuropathy, cognitive impairment, and dyspnea. So amazing. A lot of people feel the fatigue and the nausea when they have treatment, but actually, and don't want to do any exercise, but actually having a regular exercise program can reduce your side effects. This study also found, again, it improved metabolic and inflammatory markers. And like I was mentioning earlier with the fasting, reducing insulin, IGF-1, exercise seems to also reduce insulin and IGF-1 and CRP, which is an inflammatory marker. It also enhanced quality of life, so improved sleep, psychological and well-being, physical function, and just overall quality of life. So in this really large study, it seems to be still really effective. Next study was a systematic review of 42 studies, so over almost 50,000 patients involved. This looked at the association of muscle strength and cardiorespiratory fitness with all-cause and cancer-specific mortality in patients diagnosed with cancer. So what this study found was high muscle strength and cardiorespiratory fitness measured after cancer diagnosis was linked to a 31 to 46% lower risk of all-cause mortality, which is really big. And again, any like people were mentioning, doing bar, going on runs, that all improves your cardiorespiratory fitness and also muscle strength too. This study also found that even small increases in your strength reduced mortality and your cardiovascular fitness improvement, which was associated with an 18% lower cancer-specific mortality. These associations were strongest in advanced stage lung and digestive cancers, but this further just highlights fitness as a predictor of survival. The third study I looked at was 85,000 participants in the UK, and it looked at the amount and intensity of daily total physical activity, step count, and risk of incident cancer. If you know me, you know I'm always getting my steps in, and I was really happy to hear in this study that higher daily step counts was associated with a lower cancer risk. And this um, benefit seemed to plateau at about 9,000 steps a day. And other studies show that getting about 7,000 to 9,000 is really effective. But I say try to get to 10 if you can. But even a small amount is going to really lower your risk. The study also found that light and moderate vigorous intensity physical activity was inversely associated with cancer risk. So that again is further supporting that even a little bit of exercise can reduce cancer risk too. The last study looked at exercise after adjuvant chemotherapy in colon cancer patients. And this one is really interesting because they kept following up after quite a few years. So what they found, and actually what they did was they took these patients and they put them either in a structured exercise program or into a health education group. So the people that got the exercise program, what they found is that their disease-free survival rate was 80% after 5 years, whereas just the health education was 74%. So still very high, and we don't know if there was a control, no intervention, what it was, but quite a bit higher in the exercise program. The people in the exercise program had a 28% risk of recurrent or new cancers. And then after 8 years, so a few years later, overall survival was 90% in the exercise program and 83% in the health education materials group. The patients in the exercise program also had a 37% lower risk of death. So very important to try to introduce and maintain exercise throughout cancer treatment. So we talked about a lot of studies that all seem to emphasize that exercise is really important, but what are the real recommendations? So, the American Society of Clinical Oncology recommends exercise assessment and recommendations should be routine during oncology visits. So, it should be throughout having cancer that you should assess and keep doing exercise. The National Comprehensive Cancer Network advises cancer survivors strive for at least 150 minutes of moderate intensity or 75 minutes of vigorous intensity aerobic activity weekly, plus 2 to 3 sessions of resistance training. And this seems to be the general recommendation for all people, even healthy people, people going through cancer. This seems to be the general recommendation, about 150 to 300 minutes of exercise. These programs should be individualized based on the patient's condition, so I highly recommend working if you do have cancer or you're struggling with different injuries or conditions that you talk to a professional who can help come up with exercise programs tailored to you that can really help improve your fitness. So we talked about a lot of benefits. I want to hear a quick quiz question. What is one benefit of exercise during cancer treatment? Comment down below. Energy increasing. Yep. Reducing fatigue, improving sleep, mental health. Yeah, I know. Yeah, so a lot of people feel very fatigued and it can be hard to exercise, but it can be really, really helpful to on the days you feel really good to try to exercise if possible. Improve sleep, amazing. All right, great. So now I'm going to pass it on back to Lotta to talk about some practical takeaways from this webinar.
Thank you so much, Shayna. So thank you everyone for making it through this information-packed webinar. I hope you're learning some very interesting ways on how our lifestyle can influence our cancer risk. First, before we get into some takeaways, I just want to recap what we talked about today. So we talked about fasting or fasting mimicking diets and how there's some very promising information there on how it can improve cancer treatments, with the understanding that it should be individualized based on specific cancers, specific treatment plans, and also age and other factors. We always look at biomarkers and a lot of very specific information when we're recommending fasting or recommending against fasting in our clinic. And then for time restricted eating, there are really no downsides to going for the 12 to 14 hour window. It has a lot of benefits, and there's no evidence of downsides to it when we are looking at the clinical trials. Talking about nutrition, we're focusing on dietary patterns and whole plant foods, which can influence gene expression and gut health. And then for exercise, there's the recommendations to aim for 150 to 300 minutes of moderate intensity or 75 to 100 minutes of vigorous intensity exercise per week, and adding in 2 to 3 sessions of resistance training and aiming for at least 9,000 steps per day. So with that said, what can you do? We strongly recommend starting where you are currently and seeing what you can realistically add in. So if you see these guidelines and you think, oh, I'm very inactive currently, I need to go up to 300 minutes of exercise, or I need to get up to 10,000 steps, that can be discouraging and difficult to actually maintain. So starting where you are and seeing what is something that you can realistically add into your day. Is it going for a 10-minute walk around the block after lunch? Can you do squats between work calls if you're at home? If you don't like running, can you try boxing? I saw that boxing was something that somebody listed as an exercise that they enjoy. So you don't need to do something that you don't enjoy. You can find alternatives and really do some trial and error. Talking about time restricted eating, can you eat dinner 30 minutes earlier or 15 minutes earlier? Kind of figuring out a way of incorporating that into your day. Adding in blueberries to your breakfast, or swapping pasta for lentil or whole wheat pasta. Maybe bringing some baby carrots to work to eat with a sandwich. But really thinking about starting small and finding what works for you, what you enjoy, and how you can do it consistently, because that consistency is what's going to have the biggest impact on your health. So with that said, this is a year in review webinar, and we have 2026 coming up. So what's one small change that you'd like to try this month to start 2026 in a healthier way? Any of these, if there's a specific exercise or nutrition, daily steps up, cool, 10K steps per day, eating more vegetables, amazing, more plant proteins, yeah, eating the rainbow, resistance training, that's a great one. There are, like Shayna mentioned, benefits to both resistance training and cardiovascular exercise have different benefits, so it's good to do both. Water intake. Thank you, everyone. Cool. So some great tips in there. And then I also just want to cover the longevity diet, because the longevity diet is an evidence-based diet for cancer prevention, health, and longevity that was created by Dr. Longo. And you will see a lot of similarities here to what was in some of the studies that we covered today, because this is based on multiple pillars of evidence. And it's recommending plant-centric meals that can be adapted for any cuisine, really focusing on the complex carbohydrates, including low mercury, high omega-3 fish if you'd like, plant proteins, healthy fats, and plenty of those vegetables and fruits and colors, minimizing the high protein animal products, added sugars, refined carbohydrates, and ultra processed foods. And it does consider the meal timing and frequency with a 12 to 14-hour overnight fast, periodic fasting if indicated, and encouraging regular exercise and strength training. So in our clinic, we often start with these evidence-based principles and then adapt them to each patient's unique case and support them in making these changes sustainably. And I'll pass it back to Shayna, who's going to do a little quiz to finish up.
Thank you, Lotta, and thank you for all the great tips. It's really amazing to see how we can integrate nutrition, fasting, and even exercise to help improve cancer outcomes and risk. And we're excited to answer a lot of the questions in the chat box and Q&A, but first, let's do a quick quiz. So this one's a bit tricky, so read closely. The fasting mimicking diet can increase IGF-1 levels, contributing to reducing cellular proliferation in cancer cells. And it seems like everybody knows that this is false. So FMD can reduce IGF-1 levels, but it does contribute to reducing cellular proliferation. Next one is, okay, which of these dietary patterns has been shown to be have strongest evidence for reducing cancer risk? Is it plant rich, keto, or carnivore? A. Okay, everybody knows what diet they should be focusing on. Okay, great. And finally, one key biomarker that exercise has been shown to reduce. Is it your glucose, your lymphocytes, or vitamin C? A. Okay, everybody learned a lot, I hope. And now we're gonna get into the Q&A soon. And again, we are the Create Cures Clinic, which is a nonprofit organization. We provide evidence-based, integrative, and personalized strategies to support each patient on their treatment plan or throughout any disease state. We are a team of dietitians and molecular biologists, as well as Dr. Longo, to provide care to all of our patients. And there's even opportunities to have Dr. Longo or the molecular biologist directly in your case. And so if anybody is interested in reaching out, in the chat box, we have our email and link to our website as well. We have some upcoming webinars. So our next one is going to be demystifying or looking into what the science says about cleanses, fasting, and detoxification, which I'm super excited about. And I think we're going to learn a lot about this topic. So that's going to be on January 8th, and I hope everybody joins. Again, this is our link, our YouTube, if you want to watch this webinar back again or want to watch our other webinars we've done. They're all in our YouTube at the link. So now let's answer some questions. And one of the first question I saw was, how do we get our IGF-1 checked and how often is helpful? So like I mentioned earlier, we can check our IGF-1 levels, and this is just by a simple blood test. So I encourage either talk to your doctor about ordering it for you. Otherwise, there are ways where you can order it yourself. And we like to check this every 3 to 4 months.
There's also a question about, is fermented dairy like yogurt or cottage cheese beneficial or falls into the same category as regular dairy, not recommended for cancer patients? So this is one where it depends on an individual's biomarkers. If you have very high IGF-1, for example, dairy is one of the types of foods that can increase IGF-1 a lot. But if your IGF-1 is low, it's actually beneficial to increase the beneficial dairy sources like the fermented yogurt or cottage cheese or kefir, because that can help get the IGF-1 level into the normal range and then have the additional benefits of the calcium and probiotics and protein from the fermented dairy. And there's actually evidence, this was in one of our recent webinars, where we actually did a webinar that looked at dairy. So I think it's the last one or two before. You can check that one out because it found that dairy is beneficial often for colon cancer risk reduction. And that's because of the calcium and some of the compounds in dairy. So when we're looking at dairy, we do recommend prioritizing fermented dairy for the extra benefits of the probiotics, choosing unsweetened dairy, and then if you can have the organic or grass-fed dairy.
Yes, I was actually just going to say too about we did a recent webinar on dairy, so I encourage you to look at it. Someone asked, how long after waking should breakfast be? And this is a great question. So ideally, we want to have our breakfast within about an hour of waking, but we understand that this can be hard, and especially if you're trying to extend your overnight fast to 14 hours, there might be a bit of room, but ideally about an hour after waking.
I saw there were some questions in the chat too. Let me go back and see if I can find some of them. Or actually, I see there's a question about some of the beneficial bacteria in the microbiome. So one of them is Akkermansia, which has a lot of benefits to it. And that is something that can help with blood sugar regulation as well. Let me see if I can quickly find the slide. The gut microbiome. So some of the beneficial bacteria are Prevotella and Faecalibacterium. So the plant-forward diets tend to increase these beneficial species, and in part that's because plants can contain a fiber called prebiotic fiber that is like food for your gut bacteria. So there's certain beneficial bacteria that feed on this prebiotic fiber, like Akkermansia, the Colibacterium, and Prevotella. And then there's the kind of less beneficial bacteria that we don't want to be in too high quantities. And those can eat sugar and starches and create more inflammatory conditions. And one of those that I mentioned is Fusobacterium. And that's the one that's also been identified in early onset colon cancer.
Totally. And actually, Akkermansia itself, having good levels of Akkermansia also can improve your response to treatment. So, specifically in immunotherapy in breast cancer patients, they found that patients who had higher levels of Akkermansia, good amounts there, they improved or responded really well to the treatment. And like Lotta mentioned, it comes from a lot of fiber and a lot of polyphenols, so trying to get a lot of different colors in your diet. I saw a question about taking supplements versus eating vegetables, like for getting the same benefits. And we actually also have an anti-cancer food webinar that we did a few months ago that talks about how powerful each vegetable can be to improve cancer and reduce your risk. So, in general, it is going to be always better to try to eat your veggies rather than getting them as supplements because it seems actually that our body can process that a lot better. It seems to be more natural. Maybe it's because of the fiber in the vegetable that we can actually take on those polyphenols and use it in a really great way. And then also just a reminder in the chat that for specific cancer types or specific patient questions, like please feel free to reach out to us. We'd love to talk more specifically, but right now we cannot answer specific questions. I did see a question though about people over 80 years old, whether they should be doing a fasting mimicking diet or not. And definitely it depends case by case, but it is usually more important at that stage to focus on daily, overnight, shorter fasting, and a good healthy diet with protein.
And the last question that I see is a question about sugar and fruit and cancer. And this was also something that we covered in our webinar on dairy, soy, and sugar, because there is so much controversy over some of these uh, foods or nutrients. So I would recommend going back to that webinar. But with fruit, that is going to behave a little bit differently than added sugars or refined sugars because it's coming together often with fiber and with the vitamins and minerals. And then there are some strategies to help improve your glucose response or insulin response to fruit. So meal timing or nutrient timing, like having fruit at the end of the meal or pairing it with a source of protein or fat or fiber can help reduce the impact on blood sugar, which is the real like concern when we're talking about um, sugar intake in general. So I yeah, recommend going back to that webinar too. But fruit is something that is included in all of these dietary patterns that were reviewed today, especially the whole fruits, not the fruit juice so much.
Amazing. Well, we are past our time, but it was great to speak with you all, and I hope everybody learned a lot. And again, please reach out if we didn't answer your question to our email, clinic@createcures.org, and check out our other webinars if there was anything you wanted to look more into. All right,
Yeah,
thank
thank
you.
you, everyone. Have a great rest of the year.